I would say by and far the most common ailment people are looking to treat with cannabis is chronic pain, especially nerve conditions. The drugs that conventional medicine has for nerve conditions are rather ineffective, and so you can drug people with nerve pain with large amounts of opioid medications like Vicodin and such, and it doesn't quite work. So those people become more quickly desperate and looking for alternatives because nerve pain is pretty debilitating. And then the next one would be sleep. Sleep, people come to realize how extremely important their sleep is, and the range of sedatives that are available have different effects on different people. So, there are a number of conventional sedatives available beyond cannabis products that could be helpful, and yet oftentimes these people have cycled through lots of different drugs and had side effects that prevent them from utilizing them and getting their badly needed sleep, which is one of the cornerstones of caring for your health at all.
Yeah, I mean, do you find that in the homes people say, I use it for sleep?
Yeah, and I also see that they're also addicted to the medications that they have to take. They chronically get anxiety if they cannot have that, Ambien or the medication that's going to help them sleep. So we do, sometimes they ask about cannabis being helpful.
Yeah.
But then you go into the dispensary again, and, you're hoping that the bud tender can have some knowledge. And they generally will tell you an indica, there's the indica and the sativa. They'll tell you the indica is the more sedating and the more, useful when it comes to helping them sleep. So, I mean, there's that knowledge and crossover, but it's really just in regards to the flower, I don't know about the medicinal side to concentrates, the dabs and all that. It's a different story. But the oil, that's the big one, that's the one that we're all really pro-medicinal.
Yeah, the edible oils. Trisha, when you were saying hopefully the bud tender has some education, I think that bud tenders tend to be, per hour, lower wage staff that might have a high turnover. So I think they're not the ideal person for education. My deepest fantasy for all of my little old lady and men patients would be an actual, medical only dispensary, or even portion of a dispensary where it was set up specifically for medical patients, did not include candies or chocolates, only had measurable portions, and had dosing instructions attached or on each package saying, if you take 0.1 milliliter of this oil concentrate by mouth, you will consume 5 milligrams of THC and 10 milligrams of CBD. Start with 1/2 dose at bedtime.
Just like you would meet with your pharmacist.
If only it could say,
okay, here's what you're getting, here's what you need to be aware of.
Yeah.